Hi, I'm Dr. Jenny Walker. I'm a renal physician here at the hospital and Associate Chief Medical Officer. We've created zones that completely separate the two flows of patients, and it starts right from the gate where a security guard screens everybody, sends them to the front of the hospital to a red zone tent or a green zone tent, where they have further screening and then get directed into the appropriate part of the hospital.
And you've had a runny nose, is that right?
Oh yeah.
How long has that been going on?
A month or so.
A month.
Probably all of that, yeah.
Any cough?
We've really torn our hospital apart, put up new divisions everywhere to create safe zones for our patients. So if patients are coming to the hospital, they don't need to worry about how they're going to be cared for. During the lockdown, we've converted our outpatient clinic into a medical assessment unit with 22 beds and created nearly 50 negative pressure rooms through the hospital. So those are rooms where you can get between 6 to 20 changes of the air in the room in an hour. So they're the rooms where we can do things like nebulizers and high flow oxygen. We've converted what were open cubicles in ED into single rooms. They've all had negative pressure put through. Contractors have lent us their doors from their asbestos work sites so that we've got access and we can actually open the whole thing up to get a bed out. So if you open it through, you can see we now have a single room which is negative pressure and where we can put our red zone patients. We've duplicated all of our equipment. We've purchased in quite a lot of extra equipment to make sure we've got facilities in both the red zone and the green zone to care for patients.
Do you want to have a look through those and write those
We've been doing a lot of simulation training so that everybody's ready because we've recruited in more staff. People have contacted us and come forward and come back into the workforce or volunteered to work in different roles.
I'm Karen Thornton and my normal role is Capability Specialist working with the Workforce and Development team down at Tauhora House. But for the COVID-19 project I've been brought in as Clinical Nurse Manager for the COVID-19 pathways. I think it was really well coordinated given the timeframes that we were working in. We knew we had to do it really quickly because we wanted to be as prepared as we could be for the community. It started off with working with the medical teams, the ED teams, nursing and doctors and identifying what the key needs were for the services within the medical assessment unit that needed to be developed from scratch, and then also supporting the work out the front with the tents and just a lot of building relationships and coming together and making it happen equipment-wise and process-wise.
The tradies and our facilities staff have been absolutely amazing. They've worked round the clock.
There was no oxygen available in many of the rooms, so we had 3 that were able to provide oxygen on this side, and there was no negative pressure. And given the care needs of our patients that are presenting with COVID, oxygen is a need for them as well as the negative pressure. So that was something that was done in an amazing venture over about 6 days in total, and that would normally take months of work.
My name's Karen Kaitaia and I'm the Clinical Nurse Manager in the General Ward at Dargaville Hospital. We don't have isolation facility in our General Ward, and also to separate out these patients from our General Ward. So we looked at our spaces and we just rolled with our postnatal, our maternity postnatal beds and our postnatal clinic and antenatal clinic, and then through into the detox unit. All our presentations are screened prior to coming into the building, whether it be by ambulance or they're presented by private transport. The initial point of call is from the ambulance. Outside there's a phone that rings that feeds through into the green zone, and patients get tested and screened there. And then they're assessed as either potential respiratory with symptoms and directed to the red zone. Anyone else is then brought to the end of the green zone. Once we sorted out the zone was to how to keep it, that we could keep it clean. So I guess one of the major things was going through and putting the plastic all over the carpet. We had one postnatal room with vinyl and the other one with carpet. So again, we did lots and lots of plastic overlay. And then again, when we realised that we needed more bed spaces through the detox unit, we also went through and did that area as well. We converted a recreational room and detox into a positive COVID confirmed 2-bed room. Sourcing oxygen supplies for rooms that didn't have piped oxygen, setting up linen, setting up medication rooms, setting up a treatment room, setting up a resus room, sourcing ventilators, cardiac monitoring put in, being able to take that model and put it right throughout the red zone as well, so that we were able to cardiac monitor patients and have them visible from the general ward. So we've developed a full roster for the red zone, taken nurses from the general ward and got them working in red, and we've got the HCAs from the detox unit working in the red zone as well to assist with the nurse down there. And then we've moved the detox RNs down to work in the general ward to help cover the staffing gaps down there. Hello, how are you today? Staff that you know kicked in and did all the work and the maintenance, guys, it was amazing, yeah. And the people that just moved were amazing too, the midwives and the detox unit to just up and move and give us their space.
Tēnā koutou katoa, ko Mark Lansher tēnei. I'm the medical director here at Hora Hakianga in Rawene. We've split our service really into what we call a red zone and a green zone. So for the people who we're not concerned about having COVID and just have normal medical problems or accidents, emergencies, those kind of things, we're seeing them in our green zone. Our staff are working here 24/7, and then we've doing a lot more by phone, so a lot more consultations over the phone, sending prescriptions to the pharmacy, so we're trying to minimise our face-to-face contact as much as we can and trying to help people keep their bubbles intact. And then we've got our red zone, which behind us here is part of our red zone. So if we are concerned that people have got coronavirus, we'll bring them in through a different entrance at the back of the hospital here. We've got our testing centre down there that's being run by the public health unit, and you can get tested if you've got any kind of chest symptoms or sore throats, colds, fevers, and you want a coronavirus test. They're open 10 o'clock till 2 o'clock Monday to Friday, and anyone can come and see them. You don't need an appointment. And if they're concerned that you're ill and you might need to see a doctor, you might need some treatment, we'd bring you up into our red zone here, and we've got an assessment room that's just for people to use for that. And then if you need to come into hospital, we've got a little isolation area which is kept completely separate from the rest of the hospital. We're quite a small little rural hospital here. We've got 12 inpatient beds usually, and what we've done is we've got 2 of those are what they call negative pressure isolation rooms. So they've kind of got completely self-enclosed, and they've got extractor fans so that they're our first choice. And then we've got 4 other rooms we can keep completely isolated from the rest of the hospital as well. We can do some lab testing, we can do some respiratory support, we give people some oxygen, there's various bits of equipment we can do that, and we can give people medication, and we can monitor people if they're unwell. We are a small rural hospital, we don't have an ICU unit here, and if people are getting more unwell, we'd aim to get them down to Whangarei, which is our base hospital, where they've got ICU units and ventilators and more equipment and more skills down there. But often, if we think people are going to get unwell, and going to need that kind of care, we'd get them down to Whangarei. But there will be a group of people who we can look after here.
My name's Grant Cochrane. I'm the clinical nurse manager here at Bay of Islands Hospital. So I look after the emergency department, the general ward and the outpatients department. We've been fortunate, we've had a new facility only a little over a year ago, and so we've been able to adapt that facility very, very well to suit the current situation. We've been able to turn our ED into a whole bunch of isolation rooms, so each room can be isolated now. We've been able to reverse our airflow, so we've got negative pressure and a substantial negative pressure in 6 rooms, partial negative pressure in another 3. That enables us to, with a whole lot of processes and tight controls that we've got in place, function very, very well, keeping our suspected COVID and non-COVID patients in the same area but completely separate. It keeps our staff safe and it keeps our community safe. So we have also created a second emergency department. So our old emergency department that we used to use prior to the redevelopment, we have completely fitted out again as another emergency department. Should we get to the point where the pressure comes on so much that we really need to split ourselves off. So if we get to a point where we think now's the time, we can just push the button and our non-COVID patients go to our non-COVID ED, and our suspected under investigation patients come to our COVID ED. So the same with our ward, currently trading out of one space, but with really good separation. Again, nice new building, each room's got an ensuite toilet and shower, so we can really separate people off. The DHB and the Ngāti Health Service are working very closely together with this. If they have someone present to their service, go through the testing and they feel that that person needs further investigation, they'll give us a call and send that person up to us. All our community should feel safe coming to Bay of Islands Hospital at the moment. We're well set up, you know, we've got good processes in place, very, very tight controls. If you feel like you have COVID symptoms, or if you're just unwell in any other context, you can still come to our hospital and we'll take care of you. 4 weeks ago, we were, you know, really scrambling to sort of think, man, we've got to get this together. And within a very, very short time, we've created safe spaces within our existing space. We've created options if this thing intensifies. The team here who, you know, have put a hell of a lot of work into making this all happen. Really, really, really appreciative.
Kia ora koutou katoa, I'm Nita Smith. I'm the Operations Manager here at Kaitaia Hospital and also the Service Manager for Mid and Far North Mental Health and Addictions. There's an enormous amount of work that's been undertaken. Down the front of the hospital we've got a marquee set up down there. The public health nurses along with the dental assistants are doing the screening down the front. It's a drive-through setup. To do the testing, people can sit in their cars, they get asked questions. If they screen positive, then they're taken into the whare, they have the swab taken, and then they go on their way. If they need to wait a little bit longer, they'll sit in their cars and wait until they've been instructed with what they need to do. If they are unwell and need to be seen by either a GP or hospital doctor, then we'll proceed to do that as well. We've divided the hospital up into red and green zones. So the red zone is basically our operating theatre and day surgery, and the green zone is our accident and medical and our general ward. So trying to very much keep business as usual going, as well as being able to accommodate any patients that come in with suspected or possible COVID-19. So our operating theatres have been turned into negative pressure. When we do operations, we usually use positive pressure in our operating theatres, so we've been able to switch them over to negative pressure, and therefore we're able to intubate patients. So that's putting a tube down someone's mouth to help them breathe, and we're able to keep them here until the retrieval team can come and get them. We've also set the day surgery up with beds so people can actually stay here overnight. We've got 6 beds in that area that are set up so people can stay overnight until they recoup. The team here is amazing, honestly. They just work so hard, put an enormous amount of hours in. They've got a really can-do attitude. Everyone just has pulled together to do what we've done.